Dr. Stevens said, I worked a few years, 13 to be exact, with Rolling Thunder, and actually helped some babies be born in wiki-ups out there, and I learned a lot about herbs. So this is a lot about herbs, so I'm just going to fill you in on some things I learned from Rolling Thunder about the Native American way of gathering plants. And what he taught me was that when you go out, well, a lot of times when you have a problem, that plant is growing somewhere near you that can help you. So then you figure that out, and you can also, if you're just going out to collect herbs, they're usually kind of in bunches or tribes, and there'll be one plant that's bigger than the other, and they envisioned everything, even rocks, having a spirit. So what you would do was you'd make an offering to the plant or the leader of the tribe and tell him that you're going to take a little and leave a lot, because that keeps the plants going. And when I was taught about Dotsa, which is Lomation, by Shoshone man in Nevada, he says, beware of the Wachichu. And that's what Lakota called white men, or the fat takers. And these are people that will find out that this plant is medicinal, and they will go out and just rampage, take it all, leave nothing, and that's how some things go into non-existence. So their philosophy was to always be able to have that plant available, to honor it, and treat it with respect, say a prayer over it, ask it to help these people. And in the case of the Dotsa, I agreed with the chief Raymond Yao that I would follow tradition, and I would gather in the traditional way, and I would offer it to my patients free, but they had to make an agreement with me that they would pray over it. Now, praying over an herb makes it work way better, and you can use actually less herb to treat a situation. And that goes along with the water thing. So in the 1970s, I read about water when you prayed over it. I had changed the hydrogen-oxygen bonding angle. And guess what? Our patients are 98% water, right? So I always offer a little prayer at the end, optional prayer for people that I treat. And I figure that also helps by changing their bonding angle of the water in them to help them get well. So that's what you do with the herbs. If you have teach your patients to pray over it, it works much better. So that's my short blurb, as with my Indian name being Natahandi Dane. So just a little sharing, because when I started my path, I do the Lakota walk spiritually. I remember some of the medicine people saying it's time to come out from behind the bush and share this with fellow human beings, regardless of color or race. So, and a lot of this knowledge, a lot of the people that started the Eclectic Institute and stuff, I think some of that was learned from the medicine people in the tribes. And I read a book that RT gave me, a part where the government sent out these people to learn what they could about herbs from the medicine people, and then to kill them, because they wanted to wipe out that support that the tribes had, and because they wanted to eliminate the Native Americans pretty much. And the other part is my great-grandmother, I think, was Lakota full blood, so I got a little bit of that in me. So I resonate with that pretty good. So I hope that helps you, and if there's any questions, I'm open.
How lucky you were to get to work with him for so long.
What's that?
You're very lucky to be able to work with him for so long.
You bet.
Yeah.
Yeah, you can learn a lot. If you listen. He said he really liked me because I didn't ask too many questions. And he said some people ask so many questions they can't learn anything. Mm-hmm. So I'd always listen, and he would tell a story or something, and I'd be wanting to find out what herb to use on a patient that's in the Great Basin area. And he would start telling the story, and then that story would be what I needed. So I never even had to openly ask him the question. And I'd leave and do what he told in the story, and it would work. So it was really nice to have that experience in my life.